featured speaker is triple board certified in internal medicine, geriatrics, and functional medicine, and certified in metabolic cardiology, bioidentical hormone replacement therapy, bone marrow stem cell, O-shot, P-shot, and cosmetic procedures. She uses cutting-edge technology in her clinic, including bone marrow stem cell therapy, oxidative therapy, IV nutritional therapy, platelet-rich plasma, and multiple computerized devices to predict illnesses years in advance and give her patients a choice to change their path to wellness. Please welcome the #1 international best-selling author of The Fountain of Youth and Eternal Health, Dr. Lali Shaban.
I was born to be a doctor. You would think that would be easy for me to do since I come from a wealthy family and my father was a physician, a prominent physician in my country before we came to America. However, that's far from the truth. My father invested his money in real estate and wanted me to take over the family real estate business and forget about my dream of becoming a doctor. So during my last year in college, he pulls me to the side. "My darling daughter, are you still trying to go to the medical school?" "Yes, Father, it's been my dream since I was 4 years old. You know that." "I think you should forget about that dream. You should go to business school and take over the family business. I will pay for your tuition and all your expenses. I will buy you your beachfront home and your Mercedes-Benz. I will make sure you're comfortable. However, if you want to go to the medical school, I'm not supporting you. You're on your own." Well, I packed my suitcase and I left home. I had no place to go and I didn't know anyone. So I stayed in my car for 2 weeks and I managed to find 4 jobs, working 20 hours a day, 7 days a week. And I did that for almost 1 year and I saved enough money for 1 semester of medical school. With the rate I was going, I knew med school was going to be a 15-year process. After the first semester, I ran out of money and I returned home. My father picked me up from the airport and took me to breakfast. Once again, "My darling daughter, you're not going back to med school, are you? Why do you like to make your life so miserable for yourself? Just take over the family business and let me take care of you. You don't have to work this hard." Well, before I had a chance to respond, I noticed my father's breathing were really labored and he was holding his jaw. I knew something was wrong. So I got him to the car as fast as I could. I drove to the nearest hospital. I got him through the crowd into the emergency room and I yelled, "This is my father, he's having an acute MI." Immediately, the emergency room physicians and staff were attending to my father, and he was connected to a cardiac monitor. 5 minutes later, his monitor went flatline, and they called code blue. I fainted. When I gained consciousness, I was told my father was in the operating room, and within 4 hours, he had had quadruple bypass surgery. A week later, he calls me to his bedside. "My darling daughter, you saved my life. It's true. You should become a doctor." "From now on, I'm going to pay for your medical education." Yeah. Yay. You think my life got easy, right? Not me. When I was in residency program, every night I was on call. During my shift, people would die and I would resuscitate them back to life. When all the other residents had 1, 2, or 3 code arrests in their whole entire 3 or 4 years of residency, I had over 500. So I was sitting in the residence room one day on that cold bench, looking out the window and thinking, "God, why me? Why are you challenging me like this? Why is it that it's happening to me? Why is it that people die on my shift and I bring them back to life? Why am I the chosen one? There has to be a reason. I don't understand." When my daughter was a year old, she came down with a severe case of pneumonia. We were sitting in her hospital room on a chair next to her crib. I was holding her tight in my arms. The nurse had kneeled down and she was pushing a medicine into my daughter's PICC line. As soon as the medicine went in, my daughter went dead weight, and I looked at her, she was blue. I knew my baby had died in my arms. I looked at the nurse, she screamed, "What do we do? Call the code." I threw my daughter in her crib, and I started running that code with every breath I had. I was like a lioness protecting her cub. After 50 long seconds, she began to cry. It was the most joyful moment of my life. 5 years ago, I changed my medical practice from a mainstream model to a functional medicine model. Instead of waiting and watching people die on my shift and bringing them back to life and being their hero, I decided to bring them back to life 10, 15 years before they died and make them their own heroes. With that said, in my clinic, we use cutting-edge technology such as bone marrow stem cell therapy, platelet-rich plasma, oxidative therapy, IV infusion therapy, computerized testing, and many, many more devices so that we can predict illnesses occurring 10, 15 years before they do, and giving our patients a choice to change their path of illness to the path of wellness. With that said, if you want to feel better, look better, live longer, that's what we're all about at Revive MD Medical Group. Thank you for giving me a chance to speak here at the Entrepreneurship Club of Harvard Business School. Thank you. I'm honored to be here.
Lale Shubham!